What are the causes of kidney stones? It's Rebecca Morangi again. In the next few minutes, we are going to look at the causes of kidney stones and the different types of kidney stones. Let's start from the causes. Kidney stones, remember we said, can form in the kidney, ureters, bladder, or urethra. That is the urinary system. Urine contains compounds that consist of calcium, sodium, potassium, oxalate, uric acid, and phosphate. When you have too many particles of these substances in your urine and too little liquid, they can start to stick together, forming crystals or stones. At the same time, the urine may lack substances that prevent crystals from sticking together. That creates an ideal setting for kidney stones to form. And the crystals can form over months or years. Take an example of mixing salt in a glass of water. If you put salt in a glass of water, salt will start dissolving. As you continue, it will reach a point where no more salt will dissolve. The salt will become concentrated, forming crystals. That is what happens when these crystals form. And what are the types of kidney stones? We have got different types of kidney stones. We can classify them as calcium containing and non-calcium containing. Under calcium containing, we have calcium oxalate and calcium phosphate stones. And calcium containing, we have uric acid stones, struvite stones, and cystine stones. Let's look at the calcium containing, that is calcium oxalate and calcium phosphate. Calcium oxalate is the most common type of kidney stones. It counts of around 8% of kidney stones, whereas calcium phosphate stones is less common. What are oxalates? Oxalate is a chemical compound made daily by liver or absorbed from diet. Some fruits like avocado, oranges, kiwi, and vegetables like spinach, as well as nuts and chocolate, have high amount of oxalate. Dietary factors, high doses of vitamin D, and many factors that affect metabolism can make calcium or oxalate more concentrated in urine. Calcium phosphate stones are more common in metabolic conditions such as renal tubular acidosis. What do we mean when we talk of renal tubular acidosis? Is a group of disorders characterized by the kidney's inability to adequately excrete acids or retain bases, leading to metabolic acidosis despite a relatively normal glomerular filtration rate. Calcium phosphate stones can be linked with some medicines for migraines or seizures such as topiramate, an example of Topamax. Another type of kidney stones is uric acid stones. They form in people who lose too much fluid because of ongoing diarrhea or people who have trouble absorbing nutrients from food. Those who eat high protein diet or lots of organ meats, those with diabetes mellitus or metabolic syndrome. Genetic factors also may raise the risk of uric acid stones. People who have a condition called gout, uric acid is excreted in urine in excess quantity, which have uric acid stones. Another type of kidney stones is what we call struvite stones. Sometimes it's called infection stones. Struvite stones are composed of magnesium ammonium phosphate, and they form in response to urinary tract infection. These stones can grow quickly and become quite large, sometimes with few symptoms or little warning. Repeated infections can lead to a very large kidney stone that usually needs to be surgically removed. Another type of kidney stone is what we call cystine stones. This is a type of kidney stones formed from amino acid by the name cystine. They form in people with a rare genetic condition called cystinuria that causes the kidney to leak too much of a protein building called cystine. In other words, cystine is a substance made up of two cystine amino acids bound together. Up to this point, I believe we have gotten what causes kidney stones and the different types of kidney stones. Thank you so much, and let's meet in the next video. Bye bye.